Very good. So I am the actual hostess of this. It looks like Joel had way more people that came last minute. That's awesome. Hello, Patrice.
Hello.
Nice to have you with us. Hello, Joel.
Hey,
Joel.
hey, Joey. Hey, everybody. Hey, Mom. Hey, Dad.
What happened?
Hey, how's my audio?
Good.
Meant to do a sound check earlier.
No, it's real good.
Okay.
Good. How are you, Joel?
Yeah. Yeah.
That good.
Yes, we are
day.
good. We are really good. But yeah,
Good.
we're good. It's been a crazy day, but we're good.
It's I was just talking to somebody about how crazy it is and how much better it is not to look at the news.
Yes.
Yeah.
I'm going to tell you, you're going to be a lot happier if you stop watching that news.
No, I was
I'd
raised
be
on
happier if I could quit working too with these.
There you go. I quit my job in March.
Nice.
I quit in March. I said, I am done with this. And I started my own business. So.
Oh my goodness.
Yep. So I am Lori Coltrup. And for those of you that don't know me or that do know me and don't know what I do, I teach people how to get healthier naturally. And I specialize in food sensitivities, helping people to learn how to cope with food sensitivities. I have a group. It looks very small right now because there's not a whole lot of people from my group here. I'm surprised because they all begged me to bring Joel back, but I do record these. So they know that I record them. So they probably watch it on replay, right? So anyway, Joel and I met because Joel grew up with my husband. My parents are the Chrysawatis there. So it's kind of a family thing. I know there's lots of family in here. Hello, Karen. Welcome. My husband is Chuck, who is working and listening at the same time. So it's nice to have you all with us. I haven't seen the Willises in forever. I think it's probably been 15 years, probably. Yeah. So very good to see you again. And so what I wanted to do was say thank you so much, Joel, for coming back here. He was here a couple months ago for shoulder and neck pain, and the exercises that he gave us were absolutely amazing. And like I saw somebody change like their whole posture during that moment. My friend Sharonda, she was like, "Oh, like, do you remember that, Joel? She like switched. She was like, how come I could do it better with this one?" Or I don't even remember. It was really cool to see.
It's a lot.
Yeah. So anyway, Joel is here to talk about low back pain. Who here has low back pain?
not too much.
My back went out this week.
How about who here doesn't have low back pain?
I currently do not.
That's why we're all here. And maybe you'll show us, or he's going to show us how not to have it. So Joel, take it away. Tell us about this.
All right. Hey, everybody, and welcome back. Like Lori said, my name is Joel. A little bit about me. We live in Mexico. My family and I have a long background in physical therapy, health, fitness, wellness, all that kind of stuff for many, many years. Oh, yeah, spotlight. Okay, let's make sure I didn't disappear.
We wanted your head to be bigger.
Okay, so as long as I'm good, let me know if any issues with my sound. Yeah, so we've been blessed with the opportunity as a family to downsize financially, simplify so that we can be here in Mexico more full-time, one-on-one with our kids, my wife and I. And that's just opened up an opportunity for me with my health and wellness passion to be more available to people, be more available to friends, provide a lot more support, do much more teaching on a larger scale than what you're able to generally do when you're trying to make a living for your family. And you're just working for that man and going to see the people that he tells you to see and the hour that he tells you to see them. And sadly, not always able to help people get much better because you're working in this small box of what insurance allows you to do, what insurance provides, when insurance tells you to kick somebody to the curb. And so really, really grateful, long story short, to be able to spend more time working with people on more of their terms. So now I do primarily a virtual platform. So I'm going to start with a little bit of housekeeping, because sometimes I do classes like this and I forget to tell people how to contact me. So we'll just get that out there. If you don't already know and you need a pen or paper, write down a few things. I am Virtual Therapy Works, VTW. And as Virtual Therapy Works, the platform idea is just to provide therapeutic focused consultation services to individuals wherever they need to be. So right from home, services that will allow you to be able to deal with movement, mobility issues that you've been dealing with on your schedule at your time. And surprisingly, you'd be amazed to know how much can be accomplished working with someone virtually. So that's that. You can follow me on my Instagram page, which is Virtual Therapy Works. It's pretty simple. I try to post regularly. For the last few months, I've been out of commission. My dad was sick, so that was focusing all of our energy on that. He's, as you see, he's on right now. He's doing amazingly better. So that was a lot of my therapy work was on my dad. So I'm able to get back, and hopefully we'll be posting more free videos on a weekly basis, bi-weekly, just dealing with things that people are dealing with. So you have a lot of free resources. You can also check out my website, which is virtualtherapyworks.com. Gives you a better view of some of the videos, because you can blow them up on your screen instead of having to look at them on those little Instagram stories, which can just kill your eyes and create a whole nother problem that we don't want. So that's another option. So check us out there, virtualtherapyworks.com. My wife and I just recently started doing a little bit more focus on our homeschool life. We have 2 small kids, 10 and 6. And so we started another little thing called This Mexico Homeschool Life. So you can follow us over there, which we'll be focusing more on like parenting, out of the box ideas to help families and parents deal with everything that our family deals with, which is anxiety, ADHD, life, all that kind of stuff, and how you can keep functioning, stay happy, keep your kids engaged naturally as we go through that journey. So follow us over there. So those are some things. You can email me with any questions that you have after this class. I love feedback. You can direct message me on the Instagram page that I mentioned, Virtual Therapy Works, and you can email me directly at joel@virtualtherapyworks.com. Okay.
I'm putting that in the chat, so you guys, in case you didn't get it, there you go. His Instagram pages and his website and his, hopefully I got it right, email address.
Backwards, but yeah, okay. It's Joel
What's
at
it?
Virtual Therapy, Joel@virtualtherapyworks.com. Did it come up that way?
Yeah.
Okay.
Yep.
All right. So that's that. Lori asked me if I could discuss back pain on this class. So it's like, whoa, that's a big undertaking, because that's a lot of stuff. Back pain is huge. Back pain is but it's important, because 80% of the population will have a debilitating back episode in their life. So when Lori asks, like, raise your hand if you have had a back injury, 80% of people will have a back episode that will cost you 2 to 5 days of immobility, not able to work, not able to function, like just out of commission. So it's something that we should definitely all be interested in. When you talk about back issues, though, it is so varied that it's kind of hard to deal with in a class. So we're going to try to just kind of address some bullet points that I think will benefit most people, no matter what real issue you're dealing with. So when we talk about back pain, primarily you are looking at mechanical stuff that has to do with soft tissue, immobility, muscle tension. Muscle tears are probably the most common reason for chronic back pain, a muscle tear of some sort. Damage to the vertebra, the intervertebral discs, narrowing of the intervertebral spaces as we age, spinal stenosis. Those are all those keywords that you're hearing your doctors talking about, like that DJD, degenerative disc disease. I mean, and you name it. Really, we're just talking about we're shrinking, and gravity is smashing us, and there's less space for our nerves to exit the spine and feel happy. So as a result, we have compression, we have pain. But also environmentally, we are our own worst enemy when it comes to back pain, because the amount of time that we spend compressed in a seated position plays a big part in the back pain that we deal with, especially right now. Many of us are working from home, our kids are schooling from home, we're helping them from home, so we're just folded over all day long. So we have to really get out of that thought process or put ourselves in the thought mind process that we are going to be human and stand as much as we can, because that's what humans do. we stand up. Okay, I'll be referring to a few notes over the course of this. So we've got our housekeeping out of the way. All right, talk about why back pain is important, or why backs are something we want to talk about. Okay, cool. So we're just going to jump into our three main reasons that are main things that we can focus on when it comes to back pain. Back pain is generally a combination of a lack of mobility, lack of strength, and lack of flexibility. And the inability to balance, when we talk about strength, the inability to balance which muscle groups are supposed to be stronger and outrank or outcommission certain muscle groups during certain movements. So certain muscles we get just become dead and not working. So we're going to spend a little bit of time talking about strength right now. When you think about strengthening your back, probably you grab your back and you think, okay, my back muscles feel strong, they feel tight, they feel firm, but that's really not what we're talking about when it comes to back pain. We're not talking about anything really back here. There's something called cross pelvis syndrome. So a lot of times when we talk about back pain, we are going to refer to the opposite side of where our back is. We end up looking a little bit in here. So we're going to talk a lot about what's going on right here. These are our hip flexors. We're going to hold that and kind of go back to what's on the opposite ends of our hip flexors, and that's this big muscle right here, our glute max. So glutes are a big key when it comes to maintaining our back and keeping our backs from suffering so much. We sit so much, right? We're on our butts all day long. And if you think about anything that you sit on, what happens to it? It gets smashed and it stops functioning. You sit on your phone, it's for too long. If you sit on anything, eventually it's gonna die. So when we sit on our glutes all day long, we cut off circulation, we cut off flow, our muscles in this area atrophy. Your glute max is our key muscle that we're going to be talking about. We're also talking about some of this happening right here. It's your medial glute muscle, which you want to pay attention to. There's a quick little way that you can determine how your glutes are firing. Even if your glutes are strong, are they firing when they're supposed to fire? So I'm going to show you something, a little technique, a way that you can do this. It's a chair test, and you can do this sometime after class or after this class or session. And what we're going to be doing, I'm going to tilt my camera down a bit, is using the chair to help you see whether or not your glutes know when to fire and when not to. So typically, if people do this test, what will happen, you'll stand up really tall, you'll get like a simple folding chair is what you really want, something light and straight up that's gonna hit you at right about your knees. And if you stand with your knees touching the chair to begin with, and what we're gonna do is squat. So we're going to squat down, and what's going to happen to this chair is 90% of the time what happens to people who are not able to utilize their glute muscles when they want. So check it out. Do you guys see that? I'll show you again. So I went into my squat, and what happens to the chair?
Okay.
It slid away. Now it's probably about 6 to 8 inches away from my knees. Basically, what that tells me is that as I go through any movement where I squat down, my glutes are falling behind. They're not leading the show, they're trailing the show. And if your glutes are trailing the show, you will have back pain at some point in your life. Your glutes have to learn to fire first and foremost. We're going to talk about how you can do this, but I want you to see this test, and you can do it at home. You're just going to be like, man, I can't believe I can't keep this chair still. What you really want to be able to happen is to be able to go through a squat and come up without moving that chair. So we're squatting down, and I don't have to stay literally physically touching it, but I also don't want to go so far away from it. Be careful, you can lose your balance trying to keep this chair from moving, literally fall over backwards. I've seen many people do it, trying desperately to keep that chair from moving. But people who oftentimes can be very fit, can be athletes, can be very athletic, will have a very difficult time being able to keep that chair from moving, because it's a neuromuscular education component where your glutes have to learn to be primary, even over your quadricep muscle here in the front. The glute is one leading the show. It has to lead the show in order to support your back through all of your normal everyday movements. So we're going through this, and this is just your simple chair slide test. So how do we strengthen our glutes? Well, a couple of ways that I'll give you today, simple and easy. My go-to, everybody loves, is a bridge. And I think I love this to show first, because no matter what your fitness level is, no matter what your functional level is right now, no matter what level of pain you're dealing with right now, and disclaimer, any of the activities that we're going through, if they're giving you pain that I would say is somewhere between a 5 and up in your pain scale, you want to discontinue it. It's just not the activity for you right now. You can talk to me about what other ways, because we're going to go over a big bucket of exercises and activities. And for some people, everything in the bucket can help, but for some of you, only one of these activities of every one of the categories that we're going to touch on may be the one that really works for you. So if you don't be discouraged by one activity just being too painful, not giving you the results that you want, because there could be something else in the bucket that you choose from. But I'm going to try to present a lot of stuff and hopefully things that are as general that most people can do. So we're going to a back bridge. We're laying down flat. Some things to keep in mind when you're doing a bridge is to make sure that your heels are not too close to your body. So if your heels are brought in too close to your butt, your glutes and your hamstrings can go into a wicked spasm, and we don't want that happening. So make sure that you have a comfortable distance. These are best done on the floor or on the mat, but you can do them on a bed if you have a firm bed that's going to give you some good tension in return. So that's a good distance. Going to play around with that. And all I'm doing here is just trying to engage my glutes by really thinking. I like to encourage people to tighten their glutes first. So you do a little imagery, put a walnut between your cheeks, and you imagine that you're cracking that walnut, or at least you're holding it there. And once you get that going, once that walnut's not leaving where it's supposed to go, then we start the process of lift. And we're just coming straight up as high as you can without pain. Really like to encourage people to control what's going on here in their abdomens. We're trying to scoop here, the belly button, and then slowly returning back down to the mat. Simple as that. That's a glute firing exercise everybody can do. When you get up here, take a deep breath, hold it, 1, 2, 3. If you're finding that you're a bit more advanced, a bit more functionally strong, then we can kind of add in something where we're extending the leg a little bit to give yourself a little bit more challenge individually to one side of the glutes or another. That's a great way to get your glutes working for you instead of against you. Another way that we can do that is going to be in this quadruped position. So we're just kind of bringing the leg up here, and then I have people just kind of do a very simple glute pump straight up towards the ceiling. You can also do this nicely by just doing a straight leg kick and holding 1, 2, 3. But when you bend the knee here, it makes it a little bit more specific.
How are you?
And targeted to the glute. Everybody get that? Making sense so far? Okay.
Can everybody make sure they're muted?
Email. Can you just hold for one moment?
I got it.
All right, good deal, good deal. All right, so that's that should address your glute major. So make a note of that. We're talking about bridges, and we're talking about on all fours glute pumps. Just again, be cautious, suck in your stomach, try to stabilize your hips as much as you can so that we're not getting into this sway back where the back is kind of like really dipped there. That's kind of a no-no, something we want to stay away from. Try to neutralize your pelvis by scooping the abdominals up into or toward your spine, slowly bringing yourself there into that horizontal position, and then we're going into a short pump, up, 1, down, up, 1, down.
You keep your
You're
foot
standing
flexed
at
for that?
Yeah, your foot's going
Or does
along
it
for the
matter?
ride. It doesn't super matter. Yeah, try not to strain your foot. Wouldn't encourage you to point your foot because you might get a little spasm in your plantar fascia, something like that. But I mean, your glutes can work for you no matter what you're doing. So let's say you're standing at the sink, brushing your teeth, you're doing dishes, same thing. You know, we're standing at a counter of any sort, suck in, and this is a very small motion that people can do to get their glutes firing. So it's just a straight leg kickback. We can bend, we can do that same motion. Very small. The glutes are a stabilizing muscle. So one thing that you see is that the range of motion for glute firing isn't huge unless we're doing a squat. But generally speaking, to stabilize, you don't have to do a big motion to work your glutes out well, okay? We talked about your glutes being a couple of different muscles. You've got a minimal glute, you've got a medial glute. Minimal is important, the glute minus, but we're gonna talk a little bit about the medial glute right now. So this is a side clamshell exercise. I need to adjust my camera back down. So here I'm just kind of, knees are flexed, hips are flexed, feet are relaxed, and support your head however you feel most comfortable. And all we're doing here is opening up. So it's a side clam. Anybody can do this. Looks easy. It's work. Get to number 10, number 15, and you'll be sore. Some people, I'll give people this exercise, like there's nothing to it. I need to put some resistance bands or something. Be careful with that, because you can put yourself out of commission. The glute medius is not a huge muscle, and if you injure it, you could be sore and out of commission for a couple of weeks. So just encourage people to do side clam exercise. When you get up to the top, that's really where you want to squeeze. A lot of you have SI joint. You've heard of that. Sacroiliac dysfunction. This is a great exercise for a sacroiliac dysfunction because it's really carrying, it's bridging together the muscles that cross right over that fissure, the SI joint, which is your tailbone meets the ilium. So it's, and you have two of them on both sides. So if you're dealing with SI joint pain, do an exercise like this, definitely 2 to 3 times a day on both sides. So that's our side clam, once again, to help deal with that. Yeah, so that's some strengthening exercises. It's kind of simple. Oh, I did want to show you guys one more. This is a key one that I am a huge fan of while you're down here. So this one you can do accompanying with your bridge. So we did our bridge earlier where we were coming straight up. After you're done with your bridging exercises, we call this a posterior tilt and roll. So your pelvis has a little bit of space underneath your back, generally speaking. When we do our posterior tilt, we're bringing that pelvis back so that we flatten the low back onto the mat or onto your bed. When you do that, you're engaging really deeply these muscles in your abdomen called your transverse abdominis, as well as the multifidi muscles of your back. You're scooping your belly button as far in towards your spine at the same time. Very similar to the movement or feeling that you have with the Kegel activity. So you're also going to want to feel that very deep pelvic floor muscles activating, the ones that you're encouraged to do when you're trying to really get your pelvic floor tight, when you're trying to cut off the urine flow. That's that sensation that we're talking about that fires simultaneously with this posterior tilt. So you're just rolling back, tighten up. I like to hold 1, 2, 3, and release the roll. It's like a little bit of a stink. Roll back, and then uncoil the stink. Roll back, tighten up the glutes. Really feel that lower abdominal floor tighten up and release. That's a very important one for everybody, but it's a huge one for women's health. Pelvic floor dysfunction for women is one of the leading causes actually for back pain. So when I'm working with women after they've had a baby, after they've had some abdominal surgeries, after they've come out from having any kind of cuts going on, that pelvic floor activity is one that almost anyone can do pretty soon after a surgery or after an intervention, but for all of us can really help us start to firing those lower abdominal muscles. So that's really what we're going to talk about today when it comes to strengthening. It wasn't huge, right? We covered glutes. We covered this transverse abdominis movement with that posterior tilt, and we covered our side glute with that clam exercise. So pretty basic. But key muscle groups to start paying attention to so that you can get your glutes firing. And don't forget that cool little test that we showed you to try out with the chair when you get a chance. The other thing that we're going to talk about is flexibility. Flexibility is important, although it's oftentimes overrated because people can put so much emphasis on being flexible, but really don't have control of their mobility. So I do like to encourage people to do stretches, definitely stretch. Don't spend all day long stretching, strengthen at the same time. Make sure that you strengthen long so that you really develop long controlled movements. But there are a few things that you want to pay attention to when it comes to flexibility. I tell people when you get up out of bed, make sure that you spend some time doing what animals do. Look at your animal, look at what they do when they wake up, do the same thing, do it with them. Reach, lean over, touch the ground if you can, hold on to something. You've been sleeping, so you've got to take some time to just uncoil your body. First thing I do when I get up, just lean over, touch the ground. I let my hand, or if I can't touch the, I can. I've got pretty good flexibility with my hamstrings, but if you can't, just lean down as much as you can. If you need to hold on to the side of your bed, that's fine, and give yourself some support, but really try to get some length in those hamstrings going right away, lengthen up your low back, give yourself some traction there. Hip flexors, we said we were going to discuss this because it's such a huge deal. People are sitting so much. So these muscles that are right here at the front of your pelvis, as we sit, are shortened 75% of their length. So very important for the sake of your low back to learn how to open up your hip flexors. Quick and easy way that you can do that. Hold on to a chair, a kitchen counter, whatever, and we're lunging. So that's all we got to do there. Opening up the hips. Chest is super nice and high and open. It doesn't incredibly matter what's going on down there with your foot. I bring my heel off the ground because the goal here is if you put your heel flat down, it's going to be more of a calf stretch, lower leg. So really come up onto your toes and lean into it. I like to encourage people to have something to hold on to so that if you have like a knee problem, it doesn't become a lunge where you're really focusing on strength on that opposing leg. The goal here is for that leg to be passive and for us just really to lean in and get that length there that we need to have with your hip flexor. If you're okay and comfortable being on your knees, you can do a similar exercise here on the floor. You know, just really important throughout your day. If you're sitting, do a hip flexor, open up activity at least every half an hour if you can, half an hour to hour that you're sitting, waking up and really opening up that hip flexor, key to low back health. When it comes to, again, the SI joint, it gets abused. People are always thinking about stretching out their, if you have SI or sciatica or anything like that, you're always hearing people talking about like piriformis stretch your piriformis, abuse your piriformis. And yeah, you do want to do some stuff to your piriformis. Get one of these things if you're really into inflicting pain on yourself. It is amazing to have one in your home. You can get them on Amazon. If you visit my website, I have a quick reference for one that you can see what kind we're talking about. We're just talking about one of these short, multi-grooved torture mechanisms. But here what you can do with one of these beauties is, so again, we're sitting on our bottoms. We get all this tension right here through the glutes, through the SI joint, that deep fascia that's underneath the glute muscles. So with that roll, I can just kind of hover on one little side cheek, cross my knee, and then just go to work. And I do this pretty regularly, so it's not killer, but you know, I see some head shaking and over there.
I've done that before. It's very painful.
You could scream for sure, right? Yeah. But it's good stuff because again, what you're doing is just you're using deep tissue techniques, the same thing you would get if you went to physical therapist, a manual muscle therapist. They'd really get in there and work your SI joint some. It's important, but it's in the pie that we're talking about. That's a 25% piece of the pie. It's not what you should be doing all day long. So do it a little bit. Another nice way that you can stretch your piriformis, if you're sitting down at your desk or at a dinner table, chair, whatever, we're just crossing over, sitting up super tall, ankle over that one knee, and we're just trying to lean into your chest. So some of you can try that right here while you're sitting, and that's going to give us a nice SI joint piriformis stretch. So I'm going to show you a side angle view of that. All right, so just crossing the knee over. Really important not to be collapsed here. So if you find yourself having a bit of C curvature going on, bring your pelvis, bring yourself up onto your sit bones. And for a lot of people, that's enough right there. You're like, ooh, I hit it. And that can really max your piriformis flexibility out there. So that's a nice way to, again, open up that space. If you do have some sort of nerve compression happening under your piriformis. Not that many people really do, but it's a good one. It gets tight, and it inhibits mobility. And that's what we were talking about, right? Because the more natural mobility you have with your hips, with your back, the more controlled mobility overall will decrease the amount of pain that you're dealing with. Okay, we're gonna How are we doing with time? Got another?
You're doing good, Joel.
Okay.
Does anybody want to hear more? Yes. We all want to hear more. Keep going.
Okay. All right. Let me listen. All right. So where are we at? We went over flexibility. We went over some strength. Okay. So now we're going to talk about some mobility exercises that you can do. Again, when you think what's going on with your posture, a lot of the times throughout the day is your seat forward, right? Isn't this what most of us look like a lot of the day? As if you're caring for people, if you care for children, if you care for a sick person, if you care, you're just constantly leaning over. As we wash dishes, as we sit. And what happens here is that the lower curve in your back that you're naturally supposed to have, orthopedics, we call that lordosis. Everyone is supposed to have a natural amount of curve. You see some people who have a lot of curve. You see some people, especially as we get older, especially men as we get older, call it flat butt syndrome. It's a real thing. Have it in PT. You can get a diagnosis of flat butt syndrome. And this happens just because as men particularly age, you just fall off the curve. Like there's no curvature happening here anymore. Women don't tend to have that amount of problem as much because of what you guys have going on in your lower pelvis. That kind of naturally you tend to protect that a different way. But men, we absolutely do. But in general, as our population has become more and more seated, again, everyone in the population, men and women, are both dealing with that lack of lumbar curve. So that in and of itself leads to issues with the vertebra. So you end up having vertebrae that are pushed back, which as the vertebral foramen get pushed back into the exiting spaces of where those lumbar nerves come out, you end up having nerve compression. So a mechanical way that we increase mobility is just to go in the opposite direction. So this we're going to pay close attention to because it's a very there's a progression to it. And you don't want to get into the wrong place in the progression. So if you have low back pain, if you have numbness going down one or either side of your leg, here's where we're going to make a dent in that with mobility. We call this an extension protocol. All right, so to begin with, for a lot of people, just being prone on the ground or laying flat might be problematic. So what I want to see people being able to do, these pillows here because I'm gonna need them. What we want to see people being able to do is to spend time just prone. So you would just be relaxed and in this prone position for 5 minutes out of the day. For some folks, that can be in and of itself impossible and very painful. If you find that you have a lot of pain in your back by being on your stomach, then we can encourage you to put a pillow or two underneath your pelvis. That helps. I see this a lot on YouTube videos where people just lay here in that kind of position. But the goal eventually is to be able to get into a complete flat extension. So if you lay here and you're not having any pain and that feels good, that's fine. Awesome. Then we can start progressing you into an elbow prop. And if you're finding that this is comfortable enough, it may be a little tweaky, but it's not like extremely painful, then we can start doing this as our beginner's extension protocol. So if you're having low back pain, you want to be doing an extension protocol like this every day, if not several times a day, to help push those nerves that are being compressed, or that soft tissue that's compressing those nerves, back into the intervertebral spaces where it needs to be, or in between your discs where it needs to be. So here we are. We're just going down and we're coming up. Take a deep breath and back down. And we're coming back up. And we're going to repeat this 10 times. And that's it. As this gets to be more comfortable for you, if you're feeling really good with it, we can, and the goal here is that you're not letting your pelvis come off the mat or come off the ground. So here, this stays glued. So we're not lifting up where you start to see the space coming. That's not what's happening. In fact, if you need to have someone maybe, stand and put their foot just gently, not stand on you, but like, place something on your bottom to make sure that you're not coming up, that's another idea. But as you get the mobility here and you're able to really keep your pelvis flat on the mat, then you can try a little bit more extension with that. And then get really comfortable and slow and smooth with that kind of motion. All right, for an extension protocol is a really nice thing. So yeah, so that's what we call it a McKinsey extension. Then once you're going through exercises like that and you feel really good, then we can start bringing in a little bit more of active. So that was passive in the sense that your arms are pushing you into extension. Once you start to feel pretty strong there, then we can have you with your arms down to the back and then actively using your own back muscles to bring you into extension. And that's that. Pretty nice, pretty easy. Small up and downs. Oh yeah, why I don't know how I forgot this. Okay, yeah, this is super important too. If you have sciatica where you're having pain, is anybody dealing with like pain that runs down
Chuck
one side
is.
of the leg? Okay, do you have some people? Okay, so cool. I'll just throw this in there. Just want to make sure. If you do, but if you, and at some point you do in the future, this is something you could try. See if it works for you. If it's not feeling good, don't keep doing it. But we call this like a banana. So, you know, a banana is got that slight curvature, side curvature. If you can get into this prone position and that's comfortable for you, we can kind of get you into a banana. So now I've brought both legs. You guys, is that coming across? Are you seeing that?
Yes.
I brought both legs over this way and then my torso over that way. And I'm still flat, but I'm like a little banana. And then here, I can try doing a little extension. And that's gonna enable me to extend laterally to the side where I'm having the, what we call radicular pain, or pain that's going down the leg. So again, that would be for my left leg. I'm curved toward that left leg, not away from it. That making sense? I'll show that again. If it's my left leg where I'm having sciatic pain, then I'm going to curve towards that left leg. And that's where I'm going to work on that extension. Another one you can do, they call it a roadkill. So you're like, you're on the ground flat, you got one leg down, you've been run over. It's going to be able to bring that leg that's bothering you. And some of you might find that if you're a stomach sleeper, you sleep in this position. And generally speaking, that's because this feels good neurologically. So you can bring that knee up. And then here, that just might in and of itself feel great for you if you're having sciatic pain on that left side. Conversely, if you're having the sciatic pain on the right side. And then once you get there in that position, you're holding it for about a minute or two and it feels nice. Then this, you can work on a little bit of extension in that position and kind of play with that and see how that feels for mobility. I could go on, there's tons more stuff. If anybody has like a pull-up bar in their house, something that those are nice to invest in. We're fortunate enough to have an indoor jungle gym built in my son's room, and he doesn't know, but that was really built for me. But he doesn't need to know that. And so anything that you can hang on to, but if you have like a pull-up bar in your house, sometimes suspension bars or something, it's a really nice way to be able to decompress. So just, we call it decompression. Therapy gyms will do it, or therapy clinics, they'll call it traction. But you're just trying to hold on to something and then just really, there's a super way that you can do this. I don't have two solid chairs, but if you had like two very solid chairs, I'm going to use this little ottoman as my other example, and you don't have shoulder issues, you can get this distraction and decompression here. Again, this is only if you don't have any upper body, shoulder kind of issues. But what I'm doing here is I'm lifting up. On two very solid, stable chairs. And I don't have to be, and my feet are on the ground still. So I'm not like doing some crazy gymnastic activity where I'm like lifting my whole body off the ground. That's not happening. My toes are still on the ground behind me. I'm just coming up enough where my knees are off the ground. And I'm going to try my best here, even if it's just for a few seconds, take some deep breaths and really let my pelvis go and allow gravity to really take over and just pull those spaces apart. That's a kind of a mechanical way to do decompression yourself. I'm actually probably going to be doing a video pretty soon once I ordered a few things on how people can kind of do more mechanical decompression themselves at home. So, I mean, I hope some of this is helpful. We're all over the spectrum here with so many things. And back pain is huge. And some of you may be looking at some of that and be like, maybe there was 50% of that. Maybe there were just 2 items in that bucket of activities or exercises that I just threw at you that you might be able to take away. Again, if you have more specific questions, I gave you guys my email. It's down there in the notes. I don't mind you bouncing them off me. Again, though, if you're having a lot of issues that you've been dealing with for a while, make sure that you've got some clearance from your doctor so that you've done the imaging that you need to do, so you know what's going on there, so that you know if you've got some major herniations, if you've got some major tears, if you can. You want to clear that first, get his clearance before you move forward with any sort of treatment protocol. And then, yeah, I'm happy to have you schedule a visit with me, schedule a consultation. I don't have this option on my website, but if you email me at joel@therapyworks.com and let me know that you're coming, you saw me or we did a video presentation like this, or you're part of Changing Times, just throw that in there and I'll give you a 20% discount off of your first initial session with me. So we can kind of do a little bit more consultation stuff. So, but anyways, any other questions out there? Feel free to throw up a few blue hands. We have a few minutes.
Joel, thank you so much. That was awesome. I cannot wait. I mean, like, I wish I wasn't sitting on the sofa with the desk in front of me, because I would have been on the floor doing some of those things while you were talking. First thing I want to check is your email. Is it at Virtual Therapy Works or is it at Therapy Works?
At Virtual Therapy Works.
Okay, good. We had it right.
Joel at Virtual Therapy Works. Yeah.
Awesome. I feel like you covered 2 of the huge low back things. Sacroiliac dysfunction and sciatica are huge. And in my family, we have both of them just in my house with Chuck and me. So that was awesome. Now, have you found, do you want to do questions first? Hey, don't leave anybody, because I'm giving away a free gift at the end of this, okay? Do you want to do questions now? Does anybody have any questions?
I can take a few. I mean, you can take a few. If it's something super specific, I'll let you know whether or not we can address it with a short answer. But
yeah, because Joel, this is Joel's business. He does that. I mean, he just gave us way more information than any other person would give you. So please make sure you go and get a virtual appointment with him, because he's awesome. I mean, I don't have any shoulder pain anymore, but I think that's cool. Some of the things that he did and some other things that we've done. But does anybody have any specific questions, Gail? You're muted.
Yes. How do you pay for this? I know it's a business, so how do you pay, by Visa or?
Oh yeah.
I don't have a PayPal account, so how would you pay for this?
So yeah, there's on my site is what I primarily use is PayPal. But I mean, and if you're in the world of virtual business, which all of us are going to be, I strongly suggest that you, Zelle is part of almost every online banking, so you don't have to actually do anything. Most people don't even realize that you already have Zelle. So if you use online banking to check your balance or anything like that, then you there's a button down there that says transfer funds. And it's happening through a platform called Zelle, Z-E-L-L-E. So that's usually something that's already built in that you already know and have. You don't have to sign up for it. It's extremely safe and trustworthy. And you would just let me know. We would kind of let you know during that you could, before you made your appointment or booked, you would book through the website. If you're having issues booking through the website, then definitely direct message me or email me, Gail. But yeah, we'll correspond with that, and I'll just have you give you my Zelle email address, and it's super easy. You just hit click. Another nice platform to use is Cash App. or Venmo. Those all work nicely. But Zelle, I always tell people, is actually something you probably already have if you're not already using another form of electronic funds transfer.
And Mom, we can set you up on PayPal too. We'll help you out.
I ain't doing that, Chuck.
That's not really Chuck, he's virtual.
That's in our new living room. I
live
like it.
I live in a different living room. Yeah, exactly.
Yeah, he's got a different living room.
Awesome.
Joel, did you see the comments? Holly said that was awesome. Thank you so much. Cami, thanks, Joel. Lots of good information to put into practice. Patrice, great job. Love it. Felicia, thank you. Very helpful. Holly, where can I get the replay? Hey, I send it out to everyone that is on my team, the replay. I'm going to put my information here in this chat box. I will have it up on YouTube in the not too distant future. How's that sound?
That's great. Thanks.
That's my website. My YouTube is Lori Coltrip. My email is loricoltrip@gmail. I'm trying to make it as easy for people to find me as possible, okay? Any other questions? Because I have one, but I don't want to go first or second. No? Okay, I'll go. Joel, have you found any supplements or anything that has helped you to deal or help your clients or patients to deal with things, or you got any more advice with that?
Yeah, so I mean, I'm a big Young Living advocate too. So one of my favorite things is this little jar. I love it. And I actually had to smuggle it into Mexico. It's and the reason
Why
being
are you
is because,
saying that?
no, the only reason is because it's a CBD component, but this is called Nature's Ultra. It is a amazing CBD natural rub that Young Living makes. I have used other CBD products, but this one I just really find is extremely efficient. Use it on low back. My wife uses it a lot with her monthly stuff that goes on. But in conjunction with therapeutic stuff, I'll actually use it to help increase blood flow and to inhibit muscles from firing. So I know there's a whole lot of things that I'm not supposed to say when I'm endorsing certain products, but I will use it as a way of relaxing certain muscles that I don't want to fire when I am actively engaging another muscle group. So it kind of has a lot of functions. I also use it a lot for pain management. But yeah, this one is called Nature's Ultra, and it's a 300 milligram CBD. The beautiful thing about anything that's coming through a Young Living brand is that it is completely trustworthy in terms of seed to still, so you don't have to worry about other negative chemical interactions being involved in your CBD. They incorporate a lot of essential oils in here, and yeah, it's just really been a good product for me. So I use that a lot. I do use also when there's a couple of things that I use this for, the direct CBD oil. So I use that a lot for upper neck and muscle tension that people deal with when it comes to office related stuff. You have this nice little pocket right here in divot. That's a beautiful carrying spot for you to be able to hold certain oils in. And this is an area that is very difficult to get to mechanically when it comes to massage. And it can cause a whole lot of other stuff, thoracic outlet, that kind of thing. So I use that.
Hey, Joel, real quick
yeah.
with that. Is there THC in that CBD?
No, that's a nice thing. Again, yeah, I forgot to mention, yeah, there's 0.0% THC, which is the psychosomatic part of CBD that some people are concerned about. But yeah, there's 0.0 tested THC in this product. So it's a purely mechanical function, doesn't interact at all with your brain and anything up here. So yeah, nice one. If you want to know more about that, you can let me know, myself or Lori, and I can give you more information about that. That's one of my go-tos. As far as supplements,
awesome.
I'm not a huge oral supplement kind of person. I do find myself completely energized by using the Ningxia Red product that Young Living makes. I'll probably be featuring that on my website next week. So stay tuned for that, because that's an amazing product that's going to help me jam through the day as a homeschool dad.
Very cool. Thank you so much. Joel was, when he first came and gave our first class, he was not a Young Living member, and he is now. So he's sold. He's sold. So if Joel invited you, talk to him about those products. If I invited you, you can talk to me, okay? And you have my information. If you're on my mailing list, you'll get a replay of this. But I'm gonna do I think Chuck left. Dad, pick a number between 1 and 19. No, 1 and 17. Hold on. 1 and 15, sorry.
1 and 15, okay.
Yes.
7.
Stacy Bittner, you're a big winner. All right, so I'm going to give Stacy my favorite oil. It's called Peace and Calming. It is the best thing since sliced bread. Stacy, your whole family will love it. Okay? I'm gonna see you real soon anyway. I'm gonna give that, I'll special deliverize it for you, okay? Does anybody have any other questions for Joel? I'm really excited to see some people here we've never had here before. Welcome. Felicia McGinnis. Welcome. We're happy to have you here. And if you guys have any questions or anything else that you would like to talk about with me or Joel personally, we'd love to have you. I also wanted to announce one other thing. Danielle, who was here a few weeks ago with the biomagnetic pair therapist. 11 people who came to that class have already seen her. How cool is that? All right. She's coming back next Friday. I'm going to send out a notice on Monday. She's coming back Friday, and she's going to tell us how we can use our own magnets. She'll have her own. She'll show you how to get them. How we can use our own magnets to do some things at home. Okay, Reba?
She is absolutely amazing. Oh my gosh, I went to go see her. Don't let the price scare you because it's an investment in your wellness. She did things to me that I was like, oh my gosh. She corrected a lot of things is all I'm going to say.
Yeah,
so,
you know what?
Give her some thought.
Yeah. And she has a deal for our people too. So tell her Lori sent you and she'll give you 25% off your first visit. So that's pretty awesome. Dad?
Hey, Joel.
Yeah, Paul?
You were diffusing something throughout your, what
Oh, yeah.
did you have oils in there or what?
I didn't notice that.
Oh, it was coming up.
Either that or somebody's smoking.
I was gonna say, Smokey was diffusing something during
My
the
CBD. No, I've got purification going right now. Keep my air
Nice.
clean.
Nice. That's good. And I'm going to tell you, everybody, if you have to work out in this world, you should be diffusing thieves in your office. Okay. All right. So thank you all for joining us. Anybody else? Last chance. Thank you all for joining us. Reba again.
Thank
Go,
you.
go, go.
Thank you. Joel's amazing. I learned from his last session to keep my head upright and lift things, so I do appreciate that. I appreciate everything that he has shared with us, and it's invaluable. So if everybody can just, I think all of us have probably learned from him. So thank you so much, Joel, and thank you, Lori, for having these.
Thank you all for joining us today. Thank you, Joel. We'll see you soon.
All right, guys,
Bye.
take care.